Believe it or not, it's been 5 years since the start of the COVID-19 pandemic that swept across the globe. The virus claimed the lives of more than 1,000 people in both Tom Green and Taylor counties. But what changes have been made in healthcare in those very same communities? Fox West Texas's Ethan Purcell is live in studio tonight and has more. Good evening, Ethan.
Hi, Bert. 5 years might seem like yesterday to some and even longer ago to others. I spoke to some folks on the front line today about how the pandemic affected the healthcare industry.
5 years ago, masks, social distancing, vaccines, and fear were on everyone's minds in the wake of the COVID-19 pandemic. A lot has changed since then. However, one nurse at San Angelo's La Esperanza Clinic points out,
people are still sick when they have COVID, right? But it's not as scary anymore.
While the virus hasn't gone away, the changes have included some for the better, like in technology and the use of telehealth, La Esperanza's chief medical officer says.
We were able to expand it from mental health, behavioral health, to all facets of healthcare. They're utilizing telehealth services now in the emergency departments for telepsychiatry, teleinfectious disease, teleneuro.
An uptick has also been seen with washing hands, even wearing masks, and applying hand sanitizer, two things that ran low during the spread of the virus.
During the COVID pandemic, we had a shortage of these things, shortage of masks, shortage of hand sanitizers. The community is more receptive to utilizing them when it is used for a personal or a public benefit.
But Ward says things like mask mandates made people, especially in rural areas, mistrusting of the government and the medical profession, something he says they're still in the process of earning back.
By opening their doors, responding as if a member of the community to make their community better.
One of those community members says the pandemic also forced other changes in patient care.
We started looking at the healthcare as a bigger picture when COVID came. You can't get better if you don't take care of the whole patient now. If you don't take care of their diabetes, if you don't take care of their high blood pressure, then you can't take care of the whole picture, right?
But with all the changes, she says one thing will always remain.
People are always going to be sick. Healthcare is never going to go away, so we're always going to be here to take care of the patients from birth to death.
Ward also told me he thinks with the advancements in tech, it's allowing people to be more conscious of their health with things like fitness watches and apps on your phone, allowing for an even closer eye on your health. Bert?
Well, thank you very much, Ethan. You know, obviously we were focusing on healthcare and changes there. One thing that I thought was interesting was you were in high school during the pandemic and you were one of those seniors who actually had their graduation impacted mightily. What was that whole experience like?
Impacted. Yeah, that's the word, because we were only allowed to invite 10 people to graduation, first of all. They sat us on the football field. We all had to be seated 6 feet apart. We had to wear masks. It was just not the ideal graduation, we'll just say that.
A headache. And then when you got to college as a freshman, was the pandemic still fresh? What was that like for you?
Yeah, it was still fresh. I mean, we were going to class wearing masks. You had to wear a mask while you were walking outside on the ASU mall. Had to have your mask on, had to have your mask on when you got into the classroom, had to keep it on. I mean, it was not an ideal freshman year of college also.
Absolutely not. And you were far from the only person in that boat. Ethan, thank you very much.